Good evening, everyone. How are you all? Wish you're doing great. See that we have lots of people here. Let's just check that everyone is accessing this.
Evening, Miss Nesma.
Good evening, Dr. Ayman. How are you?
Alhamdulillah.
Okay. I see people here. The password is up there. Okay. Okay. Good evening.
ده بس بمس عليك يا فندم، بس مفيش
يا
حاجة.
حبيبي حبيبي يا دكتور أيمن والله.
حضرتك طلعت حبيبة ملايين، ربنا يبارك في حضرتك يا رب.
ربنا يخليك يا دكتور أيمن، والله يعني مش عارفة أقول لك إيه، ربنا يبارك لك يا رب.
يعدي الغم على كل الناس يا رب.
نفس التعليل اللي قلت لك قبل كده هفضل اقول لو
لا
احنا
ربنا
عندنا
يخليك
10
خلاص.
يربوا بس زيك كده.
يا رب يخليك يا فندم، شكرا لحضرتك.
شوف جيل مختلف تماما. ربنا يبارك فيك وفي اولادك يا رب.
الله يخليك يا فندم، شكرا لسعادتك، شكرا.
الله يخليك. طيب احنا بس I'm just checking that everyone can access. All right, I can see that people here. Okay. Yes. Okay. Right. طيب. I would like to attend this meeting if you don't mind. Mrs. Ma, nice to meet you. Of course, you're welcome. This series of lectures is going to be, inshallah, يعني, I'm trying to keep it as much as I can as a weekly meeting, okay? Because I know that lots of people have been postponed due to COVID-19 and the unstable situation around the world. I wish everyone is safe and this passes safely. So let's get started. Okay, as usual, our session is recorded. Okay, and inshallah the recording will be available on YouTube channel and also on my Facebook group, OET Seekers 2018, whenever it's ready. What I did today, because lots of people talk to me about that they are not having time to write letters and so on. So I chose 3 random letters from my groups, okay? And I'm going to start them today. And also we will have 2 cards as well. So I increased 1 letter, okay, 3 instead of 2. I will have them lively corrected, and they will be also available in the comments after the meeting is done, okay? Okay, all right. So let's get started here. We're going to share the screen, okay? Right. All right. Okay. والله يا جماعة أنا حاطة اللينك وحاطة كل الحاجات. طيب الحمد لله they accessed it. Okay, click the link. And here's the dashboard. Okay, lecture for today we have here. Okay, we have the date up there. Okay, and here we go. Okay, I'm writing to urgently refer Mr. McCree, a 62-year-old gentleman who has signs indicative of adenocarcinoma of the ascending colon. Your assessment would be highly valued. Okay, according to what I know about this letter, this man was actually diagnosed with adenocarcinoma, so he is not indicative او it's not indicative. امتى بنقول indicative او suggestive او حاجه زي كده؟ لما يكون عندي ما يدل في الكيس نوت ان هو maybe it's still a preliminary diagnosis or a provisional diagnosis but not as a confirmed diagnosis. So signs and symptoms, who has a confirmed diagnosis of? It has a confirmed diagnosis. Oh, okay. On today's review, Mr. McCree has complained of abdominal discomfort, gas, and diarrhea, which is alternative with constipation for several weeks. Okay, okay, has complained of abdominal discomfort, gas, and diarrhea, which is gases, okay, which is alternative with constipation. It's better to say which has been لأن أنا استخدمت for several weeks means it's been for a while now. Okay, so I believe that would be better. Okay, طيب. He appears unwell and he is always under pressure due to his work. Like he's always under pressure due to his work. This is something that we can call as useful information, which we can keep to the back. Okay, actually we're talking about our permanent or let's say the situation today. يعني النهارده هو عنده 1 2 3 4. He is always under pressure. This is something that is not new, so it's not important to talk about it right now. We may talk about this as a useful piece of information at the very back. Okay, his abdomen is lax and soft. However, there are neither gording nor masses, neither gording nor masses detected on the abdominal examination. Investigations have revealed that fecal blood test is positive, along with normal complete blood count level. Additionally, the colonoscopy proves that the malignancy is detected in the ascending colon. Consequently, adenocarcinoma is suspected by a biopsy. Suspected. Consequently, no, it's not suspected. It's proved, confirmed. It's not suspected. Not suspected. It is actually proved. Okay. Kindly note, Mr. McCree does not have any family history of colorectal carcinoma, colonic polyps, or inflammatory bowel disease. Mr. McCree is a smoker and his body mass index is 28.1. I would appreciate it if you take over the care of Mr. McCree and keep me updated. Okay, not bad. I think the content is well, but the purpose, خلي بالك من البيربس هنا مش مظبوط، وطبعا ده واضح معايا في الكونتنت تحت ان هو ان انت في الحالتين اتعاملت ان هو not confirmed yet. Okay, that would lead to a C plus B letter. Okay, but overall very good. I think the sentences are well structured, the tenses, the organization you started with today, you focused on today, which is the same symptoms. خلي بالكم في اللتر ده بتاع مستر دانيال ماكري انا عندي نفس السيمتومز اللي كانت موجوده في الزياره اللي هو اشتكى فيها من البروبلمز اللي هي كل الاعراض دي هي نفس السيمتومز اللي مكمله معاه النهارده. والنهارده هو جاي عشان تو تشيك هيز تيست ريزلتس، فبدل ما نخش على التيست ريزلتس كده مره واحده خبط لزق يعني من غير استئذان، لا انا ممكن ان انا اركز شويه اكتر في فكره ان انا اقول ان ممكن ان هو عنده نفس السيمتومز واشرحها، وبكده خلاص اكون انا قلت السيمتومز اللي عنده اللي هي موجوده النهارده وكانت موجوده من فتره، واتكلم في الريزلتس بتاعته. Well done. Thank you so much. طبعا if you have any questions you can ask in the chat box. That would be much better and it will save time and effort. Okay. And will allow us to share all the questions as much as we can. The following letter, okay, I can see here. Okay, so amen. All right. Thank you for seeing Mr. Jones, who has features of lower back pain because of his work. Your assessment of his workplace would be highly appreciated. Okay. اللتر ده المفروض إن في عندي patient بيرجع ليه يعني حالته بنبعتها للoccupational therapist who is not a medical personnel or a non-medical personnel. وظيفته ان هو يفهم التقرير بمنتهى البساطه، يعني ايه اللي موجود فيه بالنسبه له مهم هو occupational therapist عشان يطبقه على الحاله اللي عنده، حاله العمل يعني الراجل ده هينفع يرجع ولا لا. Okay, so I have to highlight this. Okay. Actually, thank you for seeing Mr. Jones is a good start because I'm not referring him, right? Who has features of lower back pain. He does not have features. He has sustained actually an injury. Okay. ممكن نقول مثلا who has partially recovered from a lower back injury. Okay. Because of his work. Okay. Your assessment of his workplace since he wants to return back to work. Oh, since he wants to resume his job, since he wants to resume his job would be highly appreciated. هنا أنا بهايلايت على فكرة إن هو اديته كل الداتا اللي هو محتاجها. هو جاي لك ليه؟ المين ايديا هو جاي ليه؟ والمين بروبلم اللي عنده. On كذا Mr. Jones attended to the clinic. attended the clinic. attend من الحاجات اللي مش محتاجة قوي highlights على let's say على the prepositions. Attended the clinic complaining of back pain after he had lifted a heavy object off the floor at work. At work خلاص. The pain was worsened وخلاص as he did not وأنا أفضل because أو since أفضل did not have rest. After doing an X-ray, his disc problems were excluded. Okay. He was diagnosed with severe lower back strain. Therefore, he was referred to physiotherapy. In addition, naproxen and crispridol were prescribed along with receiving a certificate of 30 days of work for his employee. بالنسبة لشخص already اللي هو occupational therapist, as we said, he's not a doctor. فبالنسبة له موضوع الأدوية والكلام الكتير في الأدوية يعني ممكن أقول analgesics. تمام؟ خلاص pain killers. اوكي؟ طيب ليه؟ لأن احنا أساس الكرايتيريا إن أنا أشوف الريسيبينت عايز إيه وأديهوله. اوكي؟ ومين هو الريسيبينت؟ هو نيرس، هو دكتور، هو non-medical personnel. هو مين بالظبط؟ هو surgeon، هو psychiatrist، تخصصه كمان ايه اللي هو محتاجه. اوكي. Prescribe along with receiving a certificate of 30 days of work for his employer. I think if we don't need for his employer، يعني مفهومة أكيد هو هياخد السيرتيفيكت دي وهيروح يديها للemployer يعني. Okay. On examination 1 month later, his back was the same and stiff. He was compliant with exercises and could walk up to and was able to walk up to 10 minutes تتكتب كاملة، مفيش اختصارات زي كده per day. Additionally, his time of work was extended another 30 days. 1 month later, on examination, he was compliant with, I think you should pay attention to this, compliant with physiotherapy and attending. Okay, some people are asking questions on Facebook. I already did that for. Okay, again, let's. Right, attending his regular appointments, his naproxen dose was increased after showing tiredness on walking for 20 minutes per day. In addition, his time of work was extended for another 30 days. طيب, a lot of repetition in that paragraph. الباراجراف ده أو اللتر ده ما فيهوش غير 3 زيارات. ال3 زيارات تقريبا ما فيهمش أي حاجة تتقال جديدة. يعني كل المعلومات الموجودة بتدل إن الحالة زي ما هي، الحالة ما بتتحسنش. في تحسن بسيط ملحوظ في آخر زيارة اللي هي today، لكن ال3 زيارات اللي فاتت أنا عندي pain، عندي stiffness، عندي extension بيتم كل مرة لل time of work. ففكرة إن أنا أفضل أعيد وأزيد فيه repetition كتير، كان الأفضل إن يتلخص بطريقة أفضل من كده، إن هو جالي 3 مرات على مدى 3 شهور، خلالهم كان فيه 1 2 3، وفي الآخر أقول إن خلال الفترة دي كان كل مرة بيجي كان بياخد 30 minutes 30 days of work. ده كان هيبقى أفضل. ده أول حاجة. تاني حاجة، أنا ممكن أعمل بس highlights هنا على let's say here. Okay. هنا مثلا عندي let's say therefore. Okay. Also we have another in addition here. On examination is additionally. Okay. Okay, 1 month later, his naproxen in addition. Okay, I guess it's too much in addition, additionally, and so on. It's too much. I think that is because of the repetition. ربما لو كان تم الاختصار شوية كان هيبقى الوضع أحسن من كده. فهو محتاج شوية تلخيص أكتر من إن هو يبقى فيه repetition ده. repetition. On today's visit on examination, I don't have to say on examination each and every time. I think that what happened also in the last paragraph. I guess that yeah, here we have another one. He was diagnosed and so on. Therefore, he was in addition naproxen on examination. Here we go. Okay, 1 month later, additionally, and so on. 1 month later on examination again. Okay, you don't have to do this. Okay, on today's visit, I understand that he came to you. حتى لو بتكتب لدكتور, we understand that this is يعني you did an examination. This is understandable. You don't have to tell me this every now and then. Repetition and formulaic language. دي formula بتكتب عشان لازم تكتب on examination. You don't have to do this. You could move with difficulty, with increased range of motion. أنا شايفة إن كان ممكن أكتبه بطريقة أفضل من كده. يعني today he has minor improvement and increased range of motion or movement despite the stiffness. اوكي ده اللي ممكن اقوله في البارت ده، لكن ان انا مش مترتبه الجمله. His pain increased after half an hour of sitting or lying down. He mentioned that he had been bored. على طول he's bored. This is a fact right now. He's bored, discouraged, and wants to return to work. Therefore, he was allowed to return. خلاص بقى، ما أنا قلت to work. Only if he does not يا جماعة، خلي بالكوا الاختصارات دي ممنوعة. Lift any heavy objects and takes regular breaks. Okay. طيب. Kindly note, Mr. Jones works as a driver for a forklift, which I find it better at the very beginning. يعني ده كان يبقى في الأول في المقدمة. يعني thank you for saying Mr. Jones a forklift driver. فخلاص أنا هفهم يعني. Okay. At the introduction. Okay. In a large warehouse, his job requires prolonged sitting with lifting heavy objects. Additionally, he wants to return to work as he feels bored. You already said that. You don't have to say that again. In terms of medication, it doesn't matter for him. It doesn't matter for him. No. For it's irrelevant for the recipient. I would appreciate it if you take over the assessment of Mr. Jones' workplace. If you require any further information, do not hesitate to contact me. ايه وظيفة ال occupational therapist؟ تخيلي انا جاوبت على ده. وهل مهم يعرف العلاج؟ لا. no. لو عايزة اقول on examination on today's بتهيألي برضو انا جاوبت على ده. المفروض ان احنا ما نقولش on examination اصلا. لو في كلمه زي range of motion مش عارف معناها وشكلها، لو مش عارف معناها اكيد هكتبها زي ما هي. write it in the same form without brackets. Okay. If you do not know the abbreviation only. لكن if you know, it's better طبعا to write it. طبعا not good. It's not good at all. طيب. Okay, the last letter. Okay. Here we go. Refer. Okay, there is a line here. Space line. Thank you for seeing Mr. Hilton, Mrs. Hilton, a 58-year-old woman. I would rather, if she has a job, okay, we'll write it down. If she doesn't have a job, we can say lady. It's much better. Whose features are highly suggestive of varicose veins. Your surgical management is highly appreciated. Okay, Mrs. Hilton has had fluoride on items and hysterectomy was done. Okay, on Kaza, aggravating pain and bilateral lower limb edema were noted. Pain and edema, something is observed and something is felt. Okay, so much better ان انا عشان مش بدل ما اعمل verbين ممكن اقول were reported. Sorry, I'm sorry. I shouldn't do this here. should be here. I can say reported along with, I cannot say along with by examination multiple varicose veins. So I can say this is the end of your sentence and this is the beginning of a new sentence. By examination, multiple varicose veins, unhealthy skin, and sensory cuff impulse test positive were observed. No, again, same thing. You observed multiple varicose veins and unhealthy skin. Okay, in addition, and this is something, and unhealthy skin were observed, okay, on examination. In addition, and your second sentence, pulse test was positive. Okay, and this is. خلي بالكم يا جماعه من حته لما تيجوا تعملوا جروبنج لحاجتين او تجمعوا حاجتين مع بعض، في حاجه بشوفها بعيني، في حاجه بعملها بالاكزامينيشن، وفي حاجه بتبقى ريبورتد. ما ينفعش كلهم اضمهم مع بعض واعملهم بفيرب واحد بس. Support stocking were advised along with surgery. Along with من الحاجات اللي ما تضمش جملتين، يعني along with, together with, as well as دول nouns. okay يبقى support stocking along with surgery were advised. بس أنا مش شايفة إن هي تنفع حتى يعني كده. support stocking was advised أو were على أساس إنهم two were advised along with planning أو discussing the surgical option. Okay, the condition if the condition worsens. Okay, after 4 days, she complained of severe pain in the right leg, not relieved by analgesics. By examination, again, another repetition يا جماعة، قللوا شوية من تكرار الحاجات كده ورا بعض ورا بعض ورا بعض، نفس الحاجة بتتكرر مرة واثنين وثلاثة. Try to decrease this. Her temperature was كذا. Pulse 100 and خلاص دي and the pulse was كذا. دي جملة جديدة مش عارفة ايه and دي جملة جديدة بقى. ممكن اقول 2 days later عشان ما اكررش. 2 days later the patients, the condition على طول عشان ما نقولش the patient. It's not preferred to increase the word the patient. The condition was improved. In addition, the redness, on the infected leg was decreased. A referral to the surgical consent was ممكن أقول بقى conducted عشان ما أكررش نفسي تاني. conducted. Sentence structures. She had a history of redness over varicosities while she was pregnant and she is a housewife. طيب, and she's a housewife, it's not related to this. Okay, ممكن كنت أقول دي housewife دي at the beginning في تعريف بالpatient. Miss Hilton, a 58-year-old housewife. بدل ما أحطها في جملة كده ملهاش لازمة في الآخر. Okay, sentence structure. And by this I mean connectors. Okay, and revise along with together with and so. Okay, as well as الverb sentence structure الverb uses برضه. Okay. طيب ده كده بالنسبة بس قبل ما أكمل وأروح للspeaking I need to go for questions here. I'll stop sharing and I'll look at the questions. Okay. What is the name of the YouTube channel? It's Nisma Rabia. Is this written in English? Yes, please keep that muted. Not clear. Handwriting is not clear. It's okay. You can follow the reading. Okay, what about the unrelieved symptoms of the past viral infection? Is it irrelevant? No, and it's not even there. لو هو فعلا كان عنده still had the symptoms of the viral infection, he wouldn't wait for 5 months. He waited for 5 months. That is a long time. Okay, it just made for a distraction. مش كل حاجة هو بيقولها I have to write it. Anyone could have viral infection and common cold in a couple of months. That would happen. Okay, that doesn't mean it relates to anything. شكرا، ربنا يخليك. شكرا يا دكتور، ده من ذوق حضرتك، ربنا يخليك. بالنسبة لجدة 2 مايو الامتحان هينعقد ولا وصل جواب إلغاء؟ والله أعتقد يا جماعة إن مش عارفة حتى الآن الأمور مش واضحة، بس I don't think إن هيكون في امتحان في 5 كمان، يعني أنا أعتقد إن 5 كله سيؤجل يعني. Lady ولا patient? I prefer lady. That would be much better than patient. I was confused where I should send my letter to be corrected. Actually, you put it in the comments. It's okay. After that, I will clarify this more. Was had. It was a mistake. By examination or in examination. Both are correct. Both are correct. Too many passive sentences in the letter, isn't it? It's better to keep your writing objectively. Okay, passive sentences are not only the sentences that start with anything other than the patient. I mean, when you write objectively, which is one of the main concerns in your writing criteria, you can start with he. I mean, you focus on the patient or the findings or the test results or any of these. That means you have something like, let's say, a focused writing. Okay. الكونكتور كان too much. مهم جدا ان احنا نركز. الكونكتورز انا محتاجه ولا لا، مش لازم طول الوقت اقول additionally. Using too much of it. In addition, additionally, and الحاجات دي لان بتبقى دايما انت focused ان انا محتاج ان انا اركز عشان الاكزامينر يفهم. هو فاهم، ما تشغلش بالك بالاكزامينر، هو فاهم، هو عارف كل حاجه and he understands everything. Just don't focus on this. Okay. طيب. Now I will move to the speaking part. I just need to okay, somebody is can we replace in addition with more? No, you cannot use moreover, you cannot use furthermore, you cannot use also, you cannot use still, you cannot use plus. It's not welcomed. Especially moreover and furthermore, they are both not welcomed at all. Okay, they are more of essay writing. طيب. الناس اللي ممكن تكون مستعدة ان هي تشارك في speaking, would you please raise your hands or say hi or anything? Okay, دكتور رانيا. Okay, دكتور عبير, دكتور شذا, دكتور جرجس, دكتور ياسر. Okay. Anyone else? Okay, so we'll be choosing like 2. Okay, I'm non-Arabic. Please give explanation to English. I'll try, but some people are not that good in English, so it might be a little bit difficult for them. Okay, so let's get started. I will start with Dr. Rania. Okay. Dr. Rania.
Hello.
Dr. Rania. Hello. How are you?
Hi.
How are
Fine, and
you?
you?
I'm doing great. And Dr. Girgis.
Yes, I am here, Doctora.
Hi, how
Doctora
are
Nisba,
you?
how are
How are
you,
you?
Doctora? I
I'm
am
doing
Arabic.
great.
I am Arabic speaker.
Okay. طيب. I will ask Dr. Rania will be the doctor and Dr. Girgis will be the patient. Okay.
Okay.
And I will share actually with you now the screen for the role play you're going to do together. Okay. Here we go. Is it clear for everyone?
Yeah, it's clear.
All right. You'll be having 2 minutes to prepare and then we will start.
So, Doctora Nisma, I have one question. In exam, I will be patient or candidate?
I'm sorry, on the exam you will be? The sound was not clear.
I will be patient or candidate?
No. We're doing this as a practice only here, okay? But on the exam, you'll be always a doctor. You never play a patient on the real exam, okay?
Okay, okay, Doctor.
Okay, have
Thank
2
you.
minutes now.
Sorry, Miss Nisma, until they prepare, can we ask about the recording of this lecture you are sent, or you will
Yes,
send
it will
on
be
which group?
uploaded. It will be uploaded on Facebook, okay? And it will be uploaded on the YouTube for people who cannot access the Zoom because it's kind of, I know it's internet is really difficult nowadays, so the Zoom server has been really difficult to deal with. So it will be uploaded as the last lecture on YouTube and the link will be on the Facebook group.
Okay, open from the Facebook.
Yeah.
From the link of the Facebook. Can we download from it? Okay, thank you.
Okay, we can start.
You still have like 30 seconds. You can go ahead and keep reading. Don't do
Okay.
this on the real test. Spend each and every second to read. Okay, we can start now.
Okay. Okay. Hello, have a seat, please. Kamel, have a
Yes.
seat, please.
Hello, Doctora.
Hi, have a seat, please.
Yes, how are you, Doctor?
Fine, and you?
Fine, Doctora.
Okay. How I can be of help today?
Doctor, I am worried. I have severe chest pain and breathlessness.
I'm sorry because you are worried about that. Just if you don't mind, can I ask you a few questions more about this pain? Is
No
that okay?
problem, Doctor. No problem, it's okay.
Could you please describe this pain in your own words?
Yeah, this pain started when I go to do any exertion, and this pain in center of my chest and referred to my shoulder.
Okay. And for how long this pain?
Doctora, is that
Sorry? Can't hear.
for a few minutes, Doctora?
For a few minutes. I'm sorry to hear that. And did you try anything to relieve this pain, or you have any medication?
I received some analgesic, but not improved, doctor, unfortunately.
Mm-hmm.
Is,
Mm-hmm.
is that serious, doctor? Is that serious?
Mm-hmm.
Going to
I'm
die,
really,
doctor.
mhm. Oh, I'm sorry to hear that. Please accept my condolences. I'm really understand your worries about this pain and the loss of your father. But just to explain what is the problem here. If I draw for you here, this is the heart. There is some tubes and pumps that can conduct the blood to the heart, called arteries and veins. So in your case, and this is blood taking oxygen to your heart. So you have this is blood, it's reduced, or the amount is little bit, maybe due to constriction for this bumps. And just let me assure you, this is a treatable condition, so there is treatment for this. If am I clear so far?
So what's my diagnosis, doctor?
So your diagnosis is something called angina. This is, sorry for this medical term. This is, means that your heart not have enough blood. So what we need to do, we need just to send you for our colleague in that they are concerned, they are specialty to treat the heart problems. This is a treatable condition, so you will have a treatment. They might need to take a blood from you just to check your glucose level, your cholesterol, checking your blood pressure. And this is important for you at this time. You have any more questions?
So, doctor, my father died at young age. So can I am going to die like my father?
I understand your concern and worries. No one knows when he or she will die. So what we need to do now to send you for our colleague to assess you more. And just we advise you not to take it hard to yourself. Don't slow down. Don't do excessive exercise or strenuous things. And as I know, there is in your note written here, you are a smoker. Smoking can increase your problem. So we advise you just to stop smoking or to decrease smoking. We have some people they can help you and to quit smoking, like in taking some patches, skin patches, nicotine patch. Could help you also.
So what
If
about
that's clear
exercise?
for you.
Okay, doctor, thank you. What about exercise, doctor?
Yes, I advise you just to take it easy to yourself. Don't do that much excessive exercise, and to make sure you will not have a real problem. So you want me to summarize for you what we talked today?
Okay, doctor.
Okay, we have a condition called angina. Means that your heart needing more blood and oxygen. We will send you to assess you more for our colleague in heart doctor specialty. They will check your blood level of glucose, cholesterol. They will need more, as they will do for you more tests. And just we advise you to take it easy, not to do strenuous exercise, and to stop smoking or cessation. This all could help you. And if you have any problem, we are here to help you. Is that okay with you?
Yes, doctor, but I want to do some image for my heart, doctor, if you don't mind.
Will be assessed by our colleague in heart problem. They will assess the need to do that. Don't worry, everything will be explained in more details.
So do doctor chest X-ray for me.
Chest X-ray. Chest X-ray. There is another test we can do. If the doctors see the chest X-ray is appropriate for you, yes, they can do it for you. Just they need to assess you first.
Okay, thank you, doctor.
Okay, you have any more question or concern?
Okay, thank you, doctor.
Thank you so much.
Okay, thank you. All right, let me talk about the good sides here, and there are a lot. Okay, first of all, as a doctor, you were able to understand the patient concerns, tried to explain the medical condition in a simple way. You highlighted the most important parts. You tried to communicate, and you kept a bond between you and the patient by asking and answering questions. I didn't accept my consolidance because it's not suitable. I'm really sorry for what happened to your father, and I really appreciate how you feel. That would be enough. It doesn't suit the situation, okay? you were involving your patient in the talk, and this is really important and vital. Okay, so that would definitely measure up to a B score. Thank you so much.
Thank you
Okay,
so much, doctor.
thank
Thank you so
you.
much.
All right. Let me see here. Yes, it will be recorded. It's recorded actually. Okay, Dr. Muhammad Sayed and um, Dr. May Alim, Dr. Muhammad Sayed.
Yes, doctor, I'm with you.
Okay, and Dr. Muhammad Sayed, can you hear us? Dr. Muhammad Sayed, I can unmute you. You can talk now, Dr. Muhammad.
Okay, I am here, Dr. Anisha.
Hello, how are you? All right,
Fine.
Dr. Muhammad and Dr. May. Dr. Muhammad, you will be the doctor, and Dr. May will be the patient. Okay. The second card is for the doctor. The first is for the patient. Okay. And you have 2 minutes exactly to prepare, and then we're going to start. Okay.
Okay.
Okay. Can you start?
Yes, I'm ready.
Okay. Okay. Let's get started.
Good afternoon.
Good afternoon, doctor.
I am Dr. Muhammad Shukri, your treating physician today. How can I help you?
Okay, doctor. I'm an 88-year-old, and my results show the doctor said to me that I have something called a urinary tract infection. The thing that bothers me is that it's recurring, and I don't. I'm sick of that and want to stop the condition from recurring. And what I can do for that, doctor?
Okay, I'm very sorry to hear that. But first, let me ask you some questions about your condition. Would you tell me about your diet, please?
I think I am eating well, healthy lifestyle, as it said. I drink plenty of fresh fruit and vegetables, and drinking plenty of water, maybe 2 glasses of water, and a coffee, maybe 2 coffees a day. I'm also very active. I walk for about 15 to 30 minutes each day. I don't know why it's happening to me.
Okay, first of all, congratulations for your healthy lifestyle. I'm pleased to hear that. But I want to highlight about good hygiene. You know, it's very important for you. I want to tell you something about the double voiding. Like emptying your bladder, waiting a moment, then to trying to empty your bladder again.
I'm sorry, I couldn't understand what you want, doctor.
I want to stress about some maneuvers may help you and overpass the situation of your recurrent UTI. I want to highlight about very good hygiene for you as a female, and we have to start a new exercise. It's called the double voiding. Okay, like emptying your bladder and wait a moment, then trying to empty it again. It may help to relieve your symptoms. Okay?
So you wouldn't prescribe me any medication if that will help me to stop this condition?
Sure, we will start an antibiotic for this infection. We will start by trimethoprim, 300 milligrams per day for 3 days. Then we will start 3 months course of low dose of nitrofurantoin. Okay?
Okay, doctor, but I'm a little bit worried about that. Will this treatment will stop the infection from recurrence?
Don't worry. With medication and good hygiene, everything else will be okay and your infection will subside. Don't be worried. Till now, your condition is still controllable. Okay?
Okay, doctor.
Thank you.
Thank you, doctor.
Okay, I think you're good, but when you were talking about the double voiding, okay, or whenever we talk about any medical procedure or medical term, we should highlight that we are going to explain this in details. Sometimes we forget and we keep talking. That might lead to the patient to just stay silent, okay? And after you finish, she or he will ask you a question. What do you mean by that? I didn't understand that. So you find that you have to speak all over again from the very beginning, which is really difficult, okay? And will get you confused. She played a kind of patient who tells you about everything at the very beginning. When you have such patient, don't panic, that's good. And you didn't, by the way. But remember, he said or she said everything. So you can start by doing some kind of a recap, like asking questions to clarify more. Well, just let me ask you a few questions to make sure that I got this right. So you said that you have like this have been happening before, for example. How many times did you fall into this? Okay. You tell me you drink lots of water per day. How many glasses exactly? So this is kind of, involving the patient again. So if he says everything at the very beginning and he decides to stay silent, it wouldn't lose you the chance to keep him involved and succeed in one of the criterion, most important criterion. Okay. The second thing, it will give you time to find things to talk about. So the card will not be short and you will finish before even 4 minutes. Okay. But overall, you did a great job. I think also this card would measure up to be very well.
Thank
Okay.
you.
Thank you. I will go again to the question parts. If the net connection caught me. Okay. Second role play. Yes, that was the second. Hello. Yes. This doctor has to ask about understanding of the patient about what he said. Yes, of course. It's always important to keep the conversation going between you and the patient. That helps a lot in making things clear. And again, to avoid that you have questions at the end of the conversation, which will give you, a hard time to repeat everything again. Okay, very well. Yes, Dr. Muhammad, exactly. Actually, that was the second card. Okay, so inshallah, next week we will have, hopefully I can manage to have another session next week. Also, we'll have 2 cards. Maybe we can increase to 3. What means of congratulating the second card? Because she has a very a good lifestyle for a person in her age. So that kind of very good thing to say and to encourage. Okay, So, inshallah, I will also try to have another session, maybe by the beginning or the end of the next week. Okay, so we can follow up again with other letters. Where can you post your letters? In the comments of the new session. When I write down the new session timing, you can write down your letters, or you can post your letters scanned, please, in the comments. And also I choose randomly from them, okay, to mark. Okay, I need to talk to you. You can contact me on on the Facebook group or on Facebook Messenger. My group. Okay, let me just post it here. I will post you the link of my group. Okay, you can see it here for everyone to see. Okay, here we go. And here we go. I sent the link here. Okay, no problem. Right, reading. I hope I can do this. I wish I can do this. I'm planning to run a session for reading and listening. I'm just planning to do this, but time is so bad. We're homeschooling nowadays, and that is the worst thing about it. Okay, how to improve reading. If you have difficulty in reading, you have to ask yourself first, what kind of difficulty do I face? Do I face problems regarding understanding the vocabulary, or do I have problems in linking the text to the questions, which is actually most common thing. If you have this, that means you need more time to read in order to find the answer. So I recommend that you read a lot. Again, answering tests or going for tests, OET tests, does not help in elevating or making your skills better. It's just wasting your time. If you have a difficulty in your skills, it would be very difficult to handle. You need to read more. You need to read more. Read every day, and read with less time. Every day, decrease the timing so you can start moving from reading each word by word to skipping and scanning step by step. You will, do this on daily basis. It will be like a mental exercise. It will help a lot. Believe me, we do this in my classes, and it works best for them. Yes, it will be sent on Facebook and to your groups as well. Okay, I'll do this. I'm trying to find your I wasn't able to I can't find yours, so I can send it to you. I'm sorry. You can download this application, Medscape, and you can read from The Guardian. You can read from any newspaper, online newspaper. It will be no Telegram group, only the Facebook group. I cannot handle all of these. Telegram is just thousands of people. Okay, only the Facebook group. Okay, I hope this lecture was helpful. Okay, and I hope to see you all again next week. Really love to have you here around. إن شاء الله يا رب كده المحاضرات بتاعتنا تكون فعلا مفيدة بالنسبة لكم. و يعني نكون بس بنحاول نعمل حاجة تساعد في الوقت الصعب ده. Stay safe. I know you can't do this. It's out of your hands. However, try your best. Okay, I know there are some questions coming at the back. I will answer them. Okay, just okay. All right. Okay. thank you. Okay, thank you all. شكرا ليكم. يا رب ان شاء الله، يا رب نتقابل تاني كده على خير. ان شاء الله الميعاد الجاي هنزله برضو على الفيسبوك جروب بتاعي وعلى الجروبات التانية. اوكي. وان شاء الله يا رب خير للجميع باذن الله. شكرا ليكم، اشوفكم على خير. wish you all the best. Thank you. Okay, I'm just questions here. No, thank you.